Assalamu alaikum everyone. I'm Dr. Aqsa Naeem and I'm working as a lecturer in Physiology Department of LUMS Jamshoro. Today the topic of my presentation is Association of Vitamin D with Obesity in Premenstrual Syndrome, a study of female population of Hyderabad, Sindh. The association between reduced vitamin D and obesity is well established. Females with PMS are more likely to have gained weight. Obese women's low calcifidiol levels are influenced by poor diets and sedentary lifestyles. PMS can be caused by a variety of causes, including hormone changes, nutrition, and lifestyle. Females suffering from PMS are more likely to have gained weight or experienced stressful events in the past year. Low calcifidiol levels are impacted by dietary and behavioral changes in obese women. Calcifidiol levels are influenced by several variables including age, sedentary lifestyle, BMI, and absence of physical activity. Neurotic personality, higher cramp intensity, increased BMI, overall self-perceived well-being, and cultural variations are all thought to impact premenstrual complaints. Mood swings, anxiety, anger, exhaustion, depression, impaired concentration, breast tenderness, and enlarged abdominal bloating and enlargement, abdominal bloating, and general pains are among the most frequently stated premenstrual symptoms, even though there are over 100 of them. The objective of my study is to find out the relationship between vitamin D and obesity in premenstrual syndrome females. Materials and methods: 250 females with a history of PMS aged between 15 to 45 years were enrolled from OPD Gynecology, Liaquat University of Medical and Health Sciences, Jamshoro and Hyderabad. Data was collected on marital status, vitamin D3 levels, PMS intensity, and BMI. The chi-square test compared the vitamin D levels with BMI and PMS scores. Inclusion and exclusion criteria were: patients in the study ranged in age from 15 to 45 years old and had a history of depression and PMS. Patients with hypertension, diabetes mellitus, chronic kidney disease, autoimmune diseases, cardiac and endocrine disorders, and those on corticosteroids or antipsychotic medications were not included. The results were 35.2% of patients had mild PMS scores and 36.4% had severe PMS. 61.2% of patients had vitamin D deficiency, with only 4.8% having sufficient serum vitamin D levels. 22.8% of normal weight patients had insufficient serum vitamin D levels. 35.6% of obese patients had vitamin deficiency in their blood. The association between obesity and vitamin D levels was significant. P-value 0.001. 18.8% of patients who had mild PMS scores had insufficient serum vitamin D levels. Those who suffered severe depression, 34.4%, had a deficiency of vitamin D. This table shows the clinical information of the patient's vitamin D levels according to BMI and PMS scores. This table shows the vitamin D levels according to BMI. And table 3 shows the vitamin D levels according to the PMS scores. Conclusion is we identified a substantial inverse connection between vitamin D levels and BMI, indicating that weight loss through vitamin D and calcium-enriched diets or supplements might result in normal vitamin D levels, and therefore PMS may be managed. Recommendation is in women with severe premenstrual syndrome, supplementation and reduction of blood vitamin D levels can help prevent and treat metabolic illnesses such as obesity, diabetes, hypertension, and depression. Larger studies are needed to further study this association and to see if 25-hydroxy-vitamin D3 levels in the follicular or early luteal stages of the menstrual cycle are connected to PMS risk. These are the references. Thank you very much. Allah Hafiz.